Well, the stress from this pandemic can be a lot for anyone to handle, and I'm joined by Colleen Dobo. She is the Senior Vice President of Adult Services at CHR. And Colleen, thank you for being here and to announce a new service that you have launched to help people out there, a new free service.
Yes, exactly. So I'm here to talk about the HERO Hotline, which is a free service that CHR is providing for people to be able to call in between 10 a.m. and 8 p.m. The hotline number is 1-888-217-HERO, and we have trained counselors who are there to assist people.
That is so amazing because I know people are struggling and they often don't know where to go. So as people start to join the feed, I'm just going to repeat this. This is the Hero Hotline. And again, the number to call is 888-217-HERO. And that way it's from 10 a.m. to 8 p.m. And you have CHR is filled with behavioral health specialists. So these are actual trained therapists who can really help people with their stress.
Yes, they are. They're all trained in specifically stress reaction. The other really great thing that we've noticed, some people who are using the hotline now are really looking for resources in the community. And so we have a large number of resources that we're able to refer people to, whether it's a food pantry, to talk with people about how to, apply for unemployment, or any of the psychosocial impact too.
Right. And this is something that is new, the type of stress that people might be experiencing. And you say it's actually even different for grocery store workers, healthcare providers, essential workers. They have a different kind of stress, a fear that they might be facing potential harm in their day-to-day life.
Exactly. There's really three sets of people that we're concerned about, and it is the people who are on the front lines, who are in our emergency rooms, who are taking care of ill people in skilled nursing facilities, which have been hit particularly hard. Then there's the family members of folks who are struggling with that, who are very concerned about their loved one going to work and coming home, and worried that that person might end up being infected, and is it affecting the kids that are in the house, and just that type of stress that's happening. And I would say the last group of people that are really experiencing things in a different way are people who have lost a loved one to COVID-19, and what it is like for them to go through that, which is it has become very complicated by the pandemic that we're experiencing.
Right. They talk about as a clinical term, complicated grief, when it's not the normal grieving process. And it wouldn't be the normal grieving process for anyone right now because we can't have regular funerals. You can't have contact with regular loved ones. Are you seeing this in the calls that come in playing out as just a real problem?
We are seeing that definitely with the calls that come in. So there's kind of two sets of issues that we're seeing. One is like the acute stress that people are experiencing for folks who have been or exposed to higher risk environments, where they might be at risk of becoming ill. Those folks are at risk of experiencing what we call an acute stress reaction. And that is basically um, something that's usually associated with when we talk about people who have been through combat or natural disasters. It's a special kind of anxiety that I can talk a little bit about the symptoms. And then it's the folks, of course, who have lost a loved one and are experiencing that bereavement and don't have the supports around them to help through the mourning process.
Yeah, let's talk about the kind of stress first, because stress is a term that we all use before the pandemic, during the pandemic. Oh, I'm stressed. I'm stressed. Then there's real stress. And when you talk about acute stress, some of the symptoms where you might need help, what are those?
So the first thing I want to say is the acute stress reaction is really a normal reaction. The important issue with it is that if it is addressed right away, it is less likely to develop into a longer term situation. So some of the normal symptoms of that, the primary primary one is really people experiencing an acute sense of arousal or hypervigilance. So it's people get into like a crisis mode, and it starts to create agitation, difficulty sleeping. There's a kind of a startle response that goes to it. It's people who are really very alert all the time, prepared for the next event that might happen. The other side of that, is the symptom of becoming disconnected, and that's when people start not having the normal reactions to something that might be in front of them. So there might be a feeling that they're not feeling as much empathy, or they're not as emotionally connected, and so maybe they might see another individual come into the emergency room and not feel the same level of compassion. And I say that one in specific because when people experience that, they often feel like there's something wrong with them, or they've become cold and they don't even recognize themselves. But that is actually a normal reaction to be able to go on functioning. So, there's those two. And then the other side of it is that numbing feeling makes it really hard for people to enjoy things when they're not at work. So you don't have the same opportunity to kind of fill up on the good things that are happening. So that's a really normal reaction that
Yeah.
happens, but it can be prolonged.
And that's what you're noticing, especially with these frontline workers, be it nurses we've talked about, are starting to perhaps have to deal with PTSD. They're helping people die alone, or grocery store workers who constantly worry they might be exposed to the virus. If you're having those kinds of symptoms, you're saying that's actually your body trying to protect you. It's normal, but it doesn't mean you don't need help.
Exactly, and it's really preventive in a lot of ways. So we've talked a lot about personal protective equipment for people to take care of themselves physically, so that they're wearing masks and gowns and shields. But we don't talk as much about what people need to protect themselves emotionally from the very normal response to this, which is, having someone to talk to about what the experience is, and using some coping strategies to get through.
So talk about that. What are some of the strategies that you're offering on this hotline? People might be thinking, oh, I don't need to call. How is talking to a stranger going to help me? How can you help people?
Yeah, so one of the things that I really think that people struggle with who are working in essential, providing vital services, is that they don't want to go home and talk to their family about it. They don't want to burden their family with what it's like for them to see another loss in the emergency room, or, to see be afraid of going to work. So they tend to keep it inside, and the hotline is really there to give people a chance to debrief, which is a normal thing that people provide after any kind of trauma. So it's just talking about like anything that happened on your shift, or some of the concerns that you have. So the hotline has trained counselors who know how to help people talk about that and help start processing it a little bit.
We do have someone on our Facebook feed. I just want to give her a shout out, that prayers and thoughts for her, a woman named Marlon, who has said that she has lost a loved one. Her mother passed, and she feels like she can't think straight. Obviously, we want to give care and compassion to, and maybe social media is a good way to let even know strangers know that you're not completely alone. But what's your advice to people who are feeling like that, who think, I can't even think straight right now because I'm under so much stress?
So the first thing I would say is that for a lot of people to lose someone to lose a loved one to COVID-19, it's really unexpected. And for many people, they haven't had the opportunity to really say goodbye and be with their loved one. So the first thing I would want to say to her is that um, that's normal, that your mind can't absorb perhaps the level of sadness and grief that you're experiencing. And really, the best thing that you can do is give yourself a chance to be patient with yourself, know that it's normal, decrease the expectations you have of yourself, and if you can take an opportunity to connect with other people, it's really hard in the environment that we're in to do that. but having FaceTime with people, or accepting phone calls from people, journaling can be really helpful. So something to help you kind of process a little bit some of the feelings that you're having.
And that's what's really important is getting that processing going. We know that that can really help people. And that's why, just people who are just joining us, we're talking about CHR and how it has now created a free hotline. It's called the HERO Hotline. It's staffed 7 days a week from 10 to 8 p.m. The number is 888-217-HERO. And this is free for anyone to call. They can talk through something, and then you actually can refer them to some ongoing therapies that you've had a lot of success giving these therapies even through telehealth.
Yes, we really have. So when people call the hotline, it is absolutely confidential. So people can call and just give us the first name and be able to talk about what's going on. And for some people, they feel so overwhelmed right now, it's hard to commit to them making an appointment to talk longer. Call as often as you need to help you get through. And if there's a point where you feel like you are able, we can do an initial appointment and start services right from the comfort of your home using telehealth, which is very simple to set up. We send you a link, you download it onto your computer, and then you have the experience, much of like the experience we're having now on Facebook. And I will tell you that people have actually felt very supported by telehealth, and a lot of people who we didn't anticipate would like it actually really do enjoy it.
Well, it's nice that you don't have to leave your house. And for those who are feeling really upset or stressed, I'm sure there's some comfort that they can talk to their therapist from the comforts of their own comfortable spot, be it their bed or a room where they don't have to get dressed and get in the car and go somewhere.
Absolutely. And there's a lot of people who live in more rural areas in Connecticut that don't have public transportation. And perhaps it would be more confidential for people if they didn't have to get in their car and drive to an agency. So yes, I think people do like that.
And how are you helping people who are also working in the nursing homes? We know that has been a really tough thing for both the family members who are concerned about their loved ones and then the people working in the nursing homes.
Yeah, I think that one of the things that we're really aware of is that the providers in the nursing homes really develop a relationship with the people they're caring for. So when they're experiencing more losses, they have a grief process that they're going through as well, and need support to be able to manage that, and also to really be talking about the fears that people are having. That the set of people working in nursing homes are, um, a good number of the people who have contracted the virus, and or are afraid to contract it. So helping them with their feelings about that, their fears, ways to protect themselves, talking about it can be really helpful.
What about the fear of finances? That's something that's very real for so many people right now. How is that affecting people, just that fear of not being able to pay their bills or basic security?
That is absolutely. I mean, we're seeing, I want to say most of the calls we've gotten so far are related to people who have lost resources and are afraid of being able to help their family. So it can be very hard when you're under that type of stress to go on the internet or call people or find out where you can go to do things or get help to do it. And on the Hero Hotline, we have all those resources compiled together, and we can help people know specifically who to call. So we've done all the research on that, and there are quite a few resources available now for people who are in that situation, really, to rent and to childcare if they need to go back to work, um, and to subsidies. So we
Okay.
have that together for them.
I mean, for so many people, it might not be something that they're used to, even getting help. But this number. Not only can you help people through their emotions, you are connecting them with programs that could help give them food or help with their rent. And I know people are asking, so I'll just say the number again. It's 888-217-HERO. It's the HERO hotline. It's open 7 days a week. You're staffing it with professionals. So even if someone feels like mentally they might be okay, but they're feeling completely overwhelmed because they don't know where to start looking for help, this phone call could help them because you've done the homework.
Exactly. So there are a lot of people who aren't essential employees working in a setting where they're more likely to be exposed, but they have lost their job and they don't have those resources. And those folks also are experiencing, a very great deal of disruption in fears and worries. And we do have those resources together and are happy to refer people to them.
And what's your advice just for at home, even in families where things are usually okay, the extra stress of perhaps limited incomes or being together a lot or kids getting on each other's nerves? I mean, the regular stressors of life can feel more acute right now, right?
Absolutely. So I would say the one thing that we are seeing more of is people um, turning to using substances to help them get through, whether it's drinking or another substance. So to really just be very cautious about that. The other thing I would say is to try as best you can in the situation you're in to keep some kind of a structure in the day. So it can be really hard if it feels like everything is so disorganized. So if you can keep, your sleep cycle in order, and if you can have meal times with your family, and for parents, you might need to play tag. So like, the kids are really rambunctious right now. I've had it as much as I can take. And so why don't you go and take care of them? And I'm going to go and like go to the bedroom and just relax for a little bit and then I'll come out. So you have to be able to like switch on and off like that a little bit.
Okay. And if you're in a single parent household, even just remembering that self-care is actually going to help your children. I know sometimes moms think they can't turn off because they have to help their kids do A, B, and C, but even giving yourself a short respite, do you find that really fuels someone's tank and then they're so much better after?
Absolutely. And I think that one of the things with all of the school at home and those opportunities is that your child is going to be okay if they don't learn their long division during this few month period. So you do the best you can if everybody's healthy and safe, to not put so much pressure on. I mean, I heard a woman talking about how she had three kids in different schools with different homework. Can you imagine trying to be the teacher of three kids when you're also working from home? So
Right.
it's like give yourself a break.
I,
It's really okay. There's not going to be a long term, like tragic thing that happens if your child doesn't learn something right now. They're going to get it.
yeah.
It's okay.
I know, I've had to check myself a little bit because you want to be a good mom and you see all this work coming in, and then maybe your child is struggling, or Dennis does a lot of the homeschooling in the morning and he's busy trying to do something for work. And it's a big wake up call that I think all of us need to say it's not perfect. And I saw a meme that said, if you're going to choose like just having some time to be kind to your family because yelling at everyone isn't making anything better.
Absolutely. Just pick your battles and you know for yourself when each person knows when they're at that point where they can't take in anymore or do anymore. And you know when your kids are too. So if the kids are that distraught or upset about needing to do their homework, there's nothing you're going to say at that point that's going to make it better. Switch gears, play a game, put a video on the TV. It's okay.
Okay, I love it. It's okay. From the expert here. We are speaking with
Yeah.
Colleen Dobo, and she is with CHR. And if you're just joining the feed, I really recommend you to share this with people who might need it in your circles, because there's a new Hero hotline, and it is 888-217-HERO. And this is something that CHR is providing for free. It's a free hotline, especially they're looking for those folks who might really need it, who are on the front lines and experiencing acute stress. The other thing that I want to ask you is, You mentioned about the people are self-medicating. We do have someone on the feed who's saying that's so true. They were doing really well and then they relapsed. What's your advice to folks who really have been maybe trying to get a handle on things and this has caused them to take a step backward?
Yeah. So the first thing I would say is that, relapse is a part of recovery, and that having, gone through a couple of weeks or however long of having, you know, not been able to maintain sobriety or being sober is okay. That it's really about getting back on track. And one of the other things that we're doing at CHR that actually is an option for people in the community is there's an application called Sober Grid, which you can download on your phone and is free. And basically, it has virtual groups, virtual 12-step meetings. I'm sure you can find them online. So there's a lot of opportunities to be able to get the same kind of support that you're used to from your home.
Sober Grid, is that what it's called?
Yes,
Okay, that's
yes.
important, right? I know so many people who rely on the 12-step meetings. I hadn't thought of that. You wouldn't be able to go right now and be together in person. So this is a way to keep your recovery in check. I know so many count on that for daily help.
Yes, and we're still opened. So if you call the Hero Hotline, for example, we'll transfer you and help you get into substance abuse services right away. I mean,
Okay.
we're taking people in for opioid treatment, alcohol, any service that we're there and we're prepared and ready to help people.
Okay, well, thank you, Colleen. I'm going to make sure everyone has the information to call the Hero Hotline again. We have a graphic that we'd like to put up, but we really do appreciate your time and encourage everyone who's listening to be kind to each other and to reach out when they need the help.
Thank you so much. I really appreciate it.
The Hero Hotline is 1-888-217-HERO. It's right there on the screen. That line again is staffed 7 days a week from 10 a.m. until 8 p.m. And you can learn more about CHR's comprehensive range of services and telehealth options. Again, they're open now and they're taking new patients. All you have to do is head to chrhealth.org.